Aspiration pneumonia is a type of pneumonia that occurs when food, liquid, saliva, or vomit is inhaled or aspirated into the lungs, leading to infection. This can cause inflammation and infection in the lungs and airways, which can be dangerous if not treated promptly. Individuals with developmental disabilities, or DD, such as autism spectrum disorder, cerebral palsy, Down syndrome, intellectual disabilities, and others are at a higher risk of aspiration pneumonia for several reasons. 1. Swallowing difficulties, or dysphagia. Many individuals with developmental disabilities have difficulty swallowing properly, which can increase the risk of food or liquids entering the lungs instead of the stomach. This is particularly common in individuals with conditions such as cerebral palsy or severe intellectual disabilities. 2. Impaired coordination of the muscles. Some developmental disabilities involve poor muscle coordination, which can make it hard for individuals to swallow and breathe normally. This increases the risk of aspiration, especially during eating or drinking. 3. Gastroesophageal reflux disease, or GERD. Many people with developmental disabilities also experience GERD, a condition in which stomach acid or food flows back into the esophagus. This can lead to aspiration of stomach contents into the lungs. 4. Decreased awareness of breathing or swallowing. Some individuals may have a reduced ability to sense or respond to the discomfort of choking or aspirating, increasing the likelihood that aspirated material will be inhaled into the lungs. 5. Severe cognitive impairment. Individuals with significant cognitive impairment may not be able to communicate if they are having difficulty swallowing or if food or liquid is entering the lungs, making it harder to recognize early signs of aspiration pneumonia. 6. Neurological issues. Conditions that affect neurological function, such as seizures or brain injury, can also increase the risk of aspiration pneumonia because they can affect swallowing or breathing. In individuals with developmental disabilities, recognizing aspiration pneumonia can be challenging, as they may have communication difficulties. However, common signs and symptoms to watch for include coughing during or after eating or drinking, difficulty swallowing or dysphagia, frequent choking or near choking on foods, fever, shortness of breath, wheezing or noisy breathing, fatigue, chest pain, or unusual or worsening behavior, especially in nonverbal or minimally verbal individuals. Preventing aspiration pneumonia in individuals with developmental disabilities involves addressing the underlying factors that make aspiration more likely. 1. Speech and swallowing therapy. Working with speech-language pathologists to improve swallowing function can significantly reduce the risk of aspiration. 2. Modified diets. Thickening liquids or altering food consistency can help make swallowing safer for individuals with dysphagia. 3. Positioning during meals. Ensuring proper positioning, such as sitting upright during eating, can reduce the risk of aspiration. 4. Monitoring for GERD. Treating conditions like GERD can reduce the chance of stomach contents being aspirated. 5. Oral hygiene. Good oral care can help reduce the risk of aspiration pneumonia, as bacteria in the mouth can be aspirated into the lungs. 6. Feeding assistance. Providing help during meals or using specialized feeding equipment may be necessary for individuals who are at high risk. 7. Regular health checkups. Regular medical checkups to monitor swallowing and lung health are essential. Early diagnosis and intervention are critical to improving outcomes for individuals with developmental disabilities who are at risk of aspiration pneumonia.